Now, primary arthritis is that wear and tear. As we, the person that runs all the time, so their knees and their hips might some arthritis, or that person that lifts a lot of weights, it could get into their shoulders or their spine if there's too much weight being lifted. And it usually occurs in the 50s and the early 60s when people start feeling that. And it can be aggressive or mild and affect only one area of the body, or it could be multiple areas of the musculoskeletal system. Secondary arthritis is usually caused by something else, like an injury, like I mentioned earlier, car accident, sports injury, a trauma that damages that cartilage, the cartilage surface. And then when it heals, it kind of has some scar tissue and inflammation, and it just sets up down the road for chances of that inflammatory condition to cause pain. If you have, a lot of us have arthritis, which is inflammation in joints and the joint spaces, but if there's no pain, then obviously we don't need anything to treat that with. Okay, obesity is a risk factor for osteoarthritis. More weight, more pressure on the joints, it makes sense. And so just a 10-pound weight loss decreases your risk of osteoarthritis about 50%. So losing weight's a great thing for not only that, but for blood pressure, blood sugar, cholesterol, and our lipid profiles. Genetics, some people, maybe they're more prone through their genetic, their family lines have had arthritis. But typically what I see, it's not really so much the genetics, it's the lifestyle that people pick their parents' lifestyle. Sure, they have their genes. Getting back to you can't pick your parents, but you can pick your lifestyle. And so if you're active and you're not heavy and you're drinking a lot of water, you may not get the same things that your parents got. But if you choose their lifestyle, then you just may. Okay. The inflammatory diseases that we talked about, like rheumatoid, they certainly will exacerbate the cartilage wear because they're destructive to the cartilage and that surface area there. And folks, and this is getting back to lifestyle choices, lack of water, excessive caffeine, sugary drinks, and alcohol all cause dehydration, lack of lubrication, and fluid in the synovial fluid, which is the fluid that bathes the cartilage that allows us to have that nice motion, that articular motion, and allow those surfaces to be able to move over one another without grinding or clicking or clanking or without pain.